back to my channel. ഏവർക്കും എൻ്റെ ചാനലിലേക്ക് സ്വാഗതം. So today we are going to discuss about trans-arterial chemoembolization, that is TACE. So what is meant by TACE? So before moving on to the session, if you have any queries related with HCPC registration or CORU registration or CMRT, that is Canadian Certification Exam, you can feel free to contact me, or if you need the study material for any GCC exams or any coaching classes, online closed coaching sessions, or if you need any scenario based interview questions for NHS interview, you can feel free to contact me. I'll be giving my WhatsApp number as well as email address in the description box so that you can feel free to contact me. So we will continue with the session. So trans-arterial chemoembolization TACE is a minimally invasive procedure used to treat liver cancer. It combines chemotherapy and embolization to target and destroy the cancerous cells. So we will see the definition of TACE, that is trans-arterial chemoembolization combines the local delivery chemotherapy with a procedure called embolization to treat cancer. Most often of the liver, it is non-surgical and minimally invasive procedure performed in radiology, usually by an interventional radiologist. In TACE, anti-cancer drugs are injected directly into the blood vessel, feeding a cancerous tumor. In addition, synthetic material called embolytic agent is placed inside the blood vessel that supply to the tumor, in effect trapping the chemotherapy in the tumor and blocking the blood flow to the tumor. So trans-arterial chemoembolization means we are giving the chemotherapy to the tumor cell with a procedure called embolization. Embolization means cutting off the blood supply to the cancerous tissue. Since we know that how the cancerous tissue is growing means it is getting all the nutrients from the blood vessel, means all the oxygen supply, nutrients, everything it is receiving. With that, the tumor cells are being there in a particular area and it is growing. Okay, so first we will introduce a chemotherapy drugs to shrink the tumor. Afterwards, we are blocking the tumor which is receiving the oxygen or the blood supply. So chemotherapy means the targeted delivery of cytotoxic drugs to the tumor site, and embolization means blocking the blood flow to the tumor, reducing its oxygen and nutrient supply. So now we will see the indications for TACE. TACE means in which all conditions we are doing this procedure. So TACE is most beneficial to patient whose disease is predominantly limited to the liver, whether the tumor began in the liver or spread to the liver, that is metastasized from another organ. So it can be either the tumor is limited either to the liver or it can be metastasized, means it can be spread from some other organ. It may also be used to shrink the tumor before surgery or to control the symptoms like pain or bleeding. So the cancer that can be treated by TACE include unresectable liver cancer, that is when surgery is not an option due to tumor size or localization. Second is the palliative treatment, that is managing the symptoms like pain, bleeding and jaundice. The third is the neoadjuvant therapy, that is shrinking the tumor before surgery to improve surgical outcomes. So these all are the indication. Then it's continue, that is hematoma or hepatocellular carcinoma, that is a primary liver cancer. Then cholangiocarcinoma, that is a primary cancer of the bile duct in the liver. Then metastasis to the liver from colon cancer or the breast cancer. Next, we will see about the contraindications for TACE. So, which all are the absolute contraindication, that is extensive tumor infiltration throughout the liver. then encephalopathy or neoadjuvant therapy. Then the relative contraindications are portal vein thrombosis, liver or renal failure, uncorrectable coagulopathy. So the patient selection. So the patient are carefully evaluated to determine if TACE is the appropriate treatment option. We have to ensure that whether TACE is an appropriate treatment option. So the factors considered include the size and localization of the tumor, the overall health status and potential risk. So the first is the tumor size and location, whether it is smaller or well-defined tumors are preferred. Then overall health status is important, that is good liver function is essential. And the potential risks are pain, fever, fatigue, nausea, vomiting and infection. So all those factors have to be taken into consideration while we are moving for a patient selection. Then how TACE works? So the treatment options for liver cancer. Okay. So the TACE attacks the liver in two ways. In two ways TACE attacks. So the first is that it delivers a very high concentration of chemotherapy or anti-cancer drugs directly into the tumor without exposing the entire body to the effects of these drugs. So we are directly introducing the chemotherapy drug directly to the tumor cell. Second is that the procedure cut off the blood supply to the tumor, trapping the anti-cancer drugs at the site and depriving the tumor of the oxygen and nutrients it needs to grow. So we are cutting off the blood supply to the tumor cells by blocking the supply to the tumor. So the liver is unique because it has two blood supply, that is an artery, that is a hepatic artery, and a large vein, that is a portal vein. The normal liver receive about 75% of the blood supply through the portal vein and only 25% through the hepatic artery. But when a tumor grows in the liver, it receives almost all of its blood supply from the hepatic artery. So 75% from the portal vein and 25% from the hepatic artery. So the chemotherapy drugs injected into the hepatic artery reach the tumor directly, sparing most of the healthy liver tissue. So we will be introducing the chemotherapy drugs through the hepatic artery. So then when the artery is blocked, after giving the chemotherapy drug, we are cutting off, means blocking the artery. The blood is no longer supplied to the liver, while the liver continues to be supplied by blood from the portal vein. This also permits a higher concentration of the anti-cancer drugs to be in contact with the tumor for a longer period of time. So now we will see the materials required for this procedure. So in this procedure, the X-ray equipment, catheter and embolytic drugs are used. The equipment typically used for this examination consists of a radiographic table, one or two X-ray tube and a television-like monitor that is located in the examining room. Fluoroscopy is used to watch and guide the progress of the procedure, and the video is produced by the X-ray machine and the detector that is suspended over a table on which the patient lies. So the materials required is X-ray tube, catheter as well as the embolytic agent. So the embolytic agent is lipidol. Then comes the chemotherapy drugs, that is doxorubicin or adriamycin. Then heparin is used to avoid the clotting of blood, and needle which is used to puncture the site. Then comes the sheath which helps to advance the catheter and guide wire, cobra catheter, SIM1 catheter and micro catheter and guide wires. So the overall procedure overview is that the TACE is performed under sedation or general anesthesia, and a thin catheter is inserted into the artery, usually in the groin, and it is guided to the liver arteries. The chemotherapeutic drug and embolytic agents are injected into the tumor feeding artery, followed by a period of observation. So first is the catheter insertion. So the thin catheter is inserted into the artery in the groin, that is the femoral artery. Then comes the navigator or to liver, that is the catheter is guided to the liver arteries under imaging guidance. So I'll do one presentation related with Seldinger technique of femoral artery catheterization. So in that there is a needle is there, then comes the guide wire catheter. So once we will be puncturing the site and through the needle we will be introducing the guide wire. Once the guide wire is in the position, we will be removing the needle, and through this guide wire, we are introducing the catheter to the area of interest. So once the catheter is in place, we will be removing the guide wire. So the guide wire is only to guide the catheter to the area of interest. So the same procedure is happening here. That is, first we will introduce a catheter, then catheter is monitored under imaging guidance or under fluoroscopy or cath lab, whatever will be the equipment, we will be monitoring under imaging guidance, and chemotherapy and embolization. So the chemotherapy drug and embolytic agents are injected into the tumor feeding artery. Then comes the observation period. So the patient is monitored for any complications or side effects. Then comes the pre-procedure evaluation. So before TACE, the patients undergo a series of tests to evaluate their overall health and determine if they are suitable for the procedure. This may include blood test, imaging scan, and a consultation with a liver specialist. So the blood test is to assess the liver function, kidney function, and the blood clotting factors. Imaging scans are CT scan, MRI scan, or ultrasound to visualize the tumor and surrounding structures. Then comes the consultation with a liver specialist to review the patient's medical history, assess the risk and benefits, and answer questions. So these are the technique and approach. So the first is the catheter placement. That is, a catheter is placed into the femoral artery in the groin. Then comes the liver artery catheterization. So the catheter is guided to the liver arteries under imaging guidance. Then comes the chemotherapy administration. So the chemotherapy drugs are injected into the tumor feeding artery, and then comes the embolization. Embolytic agents are injected to block the blood supply to the tumor. So these are the potential complications. So as with any medical procedure, the TACE carries certain risks, although they are generally considered low. So, but the possible complications include bleeding, infection, allergic reactions, and damage to the nearby organ. So the first is the bleeding, that is bleeding at the injection site or within the liver. Then comes the infection at the injection site or within the liver. Then comes the allergic reaction, that is allergic reaction to the chemotherapy drugs or embolytic agents, or organ damage, that is damage to the nearby organs such as the gallbladder, bile duct or intestine. So stage 1, stage 2, stage 3 and stage 4 liver cancer you can find out in this image. Then comes the post-procedure cancer. So after TACE, the patients are monitored closely for any complications or side effects. They may require a short hospital stay for observation and pain management. First is the monitoring, that is close observation for any signs of bleeding, infection or allergic reaction. Then comes the pain management, that is the medication may be prescribed to manage the post-procedure discomfort. Then comes the follow-up, that is regular follow-up appointments with the liver specialist to monitor the tumor response and overall health. Outcomes and follow-up. TACE can effectively shrink the tumor, improve the symptoms and prolong survival in patients with liver cancer. Regular follow-up appointments are crucial to monitor the tumor response, assess any side effects, and adjust the treatment as needed. So the tumor response means regular imaging scans to monitor the tumor size and response to treatment. Side effects, assessing for any side effects from the chemotherapy, drugs, or embolization. And then comes the treatment adjustment, that is adjusting the treatment based on tumor response, side effects, and overall health status. So with that, I'm winding up today's session. Hope it is clear. If you have any queries related with the presentation or any new topics have to be included, you can feel free to contact me. Until then, stay safe and healthy for the next upload.